Okay, so this is it. This is the culmination of all the studies, all the hard work that you've put in. It's time for the national boards. I'm Mark Sowers, and I have a few tips that might help you approach some of the questions you're going to see on the national board exam. Now, the first thing I'll tell you about the National Board exam is this is not something you can just take casually. This is something you really want to spend a lot of time preparing for, and really the best way that I can think of to prepare for the National Board, and something that worked for me when I took a couple years ago, is simply being exposed to as many questions as you possibly can. Just spend time reading more and more questions. Find questions on the internet. Just go through any source of questions that you can find. Books are out there, apps are out there, lots of different sources for different questions. That's really going to help you. The more questions you're going to be exposed to, the more types of questions you're going to be exposed to, or the more approaches to reading questions that you're going to have as you are exposed to these questions. That's going to really probably be the best way to help you. So as many questions as you can possibly find, read them, go through them, see if you can answer them, and then practice with more and more questions. That's my number one tip for you. Now, to help you with that, I'm going to go through several questions here, and we're going to go through a couple of approaches to these questions and how to figure out what might be the best answer. And we're just going to go through some of the harder questions that you might be exposed to. Now, don't worry if some of the questions that I give here today seem like they're a little difficult, you don't know the answers to those, that's okay. I purposely chose some rather difficult questions, so don't freak out. A lot of the questions you're going to see on the National Board are going to be easier than these, so we're just going to go through some of the harder questions and see how we can approach them. So one difference that you may notice about some of the questions that appear on the National Board exam versus other questions that you're finding on the internet or maybe in your classes is that the way they're written is a little bit different. Take, for example, this question. This is probably the type of question that you're used to seeing. Maybe you played Kahoot and you see these nice short questions. Vaccines are an example of which type of immunity. Nice, short, brief, to the point question. The answers: artificially acquired active immunity, artificially acquired passive immunity, naturally acquired active immunity, and naturally acquired passive immunity. Nice and short and sweet. And these nice, short, sweet questions are good for things like playing Kahoot, or maybe in a scrub bowl where you're competing, trying to answer that question fast. You have to read the question fast, answer it fast. That's not the approach that I want you to take on the national boards. So the national board questions, I want you to take your time. Take your time to read them because they're not going to be written in such a nice, concise way. Here's how this question would actually be written on the national board. Bruce Banner has received his third hepatitis B vaccine and should have enough antibodies to protect him from exposure. This is an example of what type of immunity. Now notice they've asked the exact same question here, but they've really expanded the wording so that you sort of have to go in and pick out what's going on, what is it that they're trying to ask. It's not real simple and real clear. You've got to go in there and figure out, okay, what exactly are they asking here? Oh, they're asking about vaccines and what type of immunity vaccines provide. So it takes a little while to sort of suss out exactly what they're asking in this question. And the answer is A, artificially acquired active immunity. Now, a vaccine is artificial as opposed to natural because you're purposely injecting antigens into your body as opposed to just acquiring a cold or a disease naturally. So that's why it would be artificial. And it's active versus passive because you're creating active antibodies from it. The antibodies that you get from a vaccine are going to actively attack any new pathogen that's very similar that comes along. So let's take a look at another question. Here again, a whole lot of words going on. This is a long question. It's going to take some time to read it and figure out exactly what's going on. Dr. Becca is performing a total abdominal hysterectomy on a patient with uterine fibroids who is experiencing excessive uterine bleeding during her menstrual periods. If the surgeon needs to grasp the fallopian tube or ovary, which instrument would you have ready to pass? So you can see here what they're asking is, okay, what instrument do you use to grasp the fallopian tubes or an ovary? Well, you want something atraumatic, so that's probably going to be the Babcock. But you see how the question has a lot more going on, and you sort of have to work your way down to figure out exactly what they're asking. So let's take a look at another question. Dr. Becca is performing a total abdominal hysterectomy on a patient with uterine fibroids. Wait, we've already seen this. So we already know the answer is A, right? So just put A. Wait, this is something that you might see on the national boards where the setup for the question is the same as the setup for a previous question that you've already seen, but then they ask a different question based on that setup. So here, that same setup with Dr. Becca performing the total abdominal hysterectomy for uterine fibroids. But the question this time is, preoperatively, the patient may have which type of catheter inserted, a Malacot, Foley, Fogarty, or mushroom. And in this case, you might recognize that the answer is the Foley. Now, what are some of these other answers? The Malacot and the mushroom are both similar catheters, except they don't use a balloon. They have a little piece of the catheter itself that sort of expands out, and that's what holds it in place. And a Fogarty catheter, what's that? Well, that's not even a urinary catheter at all. That's a vascular catheter, so that's completely different than what we would be using in a hysterectomy case. So let's take a look at yet another question. Dr. Becca, it's Dr. Becca again doing that total abdominal hysterectomy. So the same setup yet again for yet a new question. In this case, the question is, the patient's preoperative diagnosis is metrorrhagia, menorrhagia, dysmenorrhea, or menorrhagia. So to answer this question, we now have to go back to that setup that we've been seeing for the last couple of questions and figure out just what's going on. Okay, so the patient is experiencing excessive uterine bleeding during her menstrual periods. So which one of these words describes excessive uterine bleeding during menstrual periods? Now, many of you may already know the answer, or maybe you've even been able to sort of narrow it down to two because there's two there that kind of look familiar, words that you probably hear a lot, B, menorrhagia, and C, dysmenorrhea, but maybe you're not sure, okay, which one is it? I'm not quite sure. At least you were able to narrow it down. But even if you don't know any of those words, or even if you're not sure, it could be any of those that describes this, I'm going to give you a little tip here to sort of give you insight into what the question writers might be thinking. So if I didn't know the answer at all, or if I had it at least narrowed down to two, here's an approach that I might take, and it works with this particular type of question. And it sometimes works with other questions, not always, but sometimes it does. So take a look at this. What I do is I know, okay, one of those answers is right, and they're trying to write distractors, things that are going to distract me from that right answer. So they're going to write answers that look similar to the right answer. So let's see if we can find answers that kind of look similar. So let's start with the first part of the word. Now, 4 words there, 2 of which happen to start exactly the same. We have B, menor, and D, menor. Okay, so those 2 words start exactly the same. Well, that sort of might be a hint. It's hard to tell for sure, but let's continue. Let's look at the second half of the word. So the answer A ends in rhasia, and the answer B ends in rhasia as well. So again, they're trying to write something that's similar to the right answer. And look what happens when you do this. Well, you find that the beginning part, menor, is repeated, and the last part, rhasia, is repeated, but only one answer has both of those repeated at the same time. So guess what the answer might be? It's going to be B, menorrhagia. So even if you had no idea what the answer was, or better yet, you were able to narrow it down to 2, you're now able to see, okay, this one seems to be the one that the writers are trying to distract me from a little bit. So that might lead me to the correct answer. And indeed, the correct answer is menorrhagia. Menorrhagia is the term for excessive uterine bleeding during menstrual periods. Now that during part happens to be key here because metrorrhagia happens to be uterine bleeding outside of the menstrual period. Dysmenorrhea, that's a term you've heard, and in this case, that's referring to painful menstruation. Not necessarily excessive bleeding, but it's painful, so that's dysmenorrhea. And the word menorrhagia is sort of almost a made-up word. It's used occasionally. Basically, it means the same thing as dysmenorrhea. It means painful menstrual periods. So the best answer here, excessive bleeding during the menstrual periods, is menorrhagia. So let's take a look at another question. Dr. Beck is still performing her total abdominal hysterectomy. Now the question's asking about uterine ligaments. Okay, great. I know uterine ligaments, the broad ligament, the first answer I see, broad, that's got to be the answer, right? Move on to the next question. one of the things that test writers for the National Board like to do is use the word except. And what the word except does is it says that 3 of the answers are related to the question and 1 of them is not. And it's the not one that we're trying to find. So that forces us to read all the answers, check off as many as we can that we know, and then whatever is left, try to figure out which one really wouldn't fit the question that's being asked. So the broad ligament, yeah, that's a ligament that supports the uterus. The round ligament, also a ligament that supports the uterus. And the cardinal ligament, also a ligament down towards the cervix of the uterus. So what's left? The cruciate ligament. Now, I've heard of the cruciate ligament, but wait, where is that? Oh, that's right. The cruciate ligaments are in the knee. So that's a completely different area. That's going to be the one that's not involved with the uterus. So that's going to be the correct answer to this question. So let's take a look at another question. Dr. Becca, oh boy, she's still performing this total abdominal hysterectomy. Let's see what's going on this time. In a premenopausal patient who wishes to preserve fertility, the surgeon may elect to remove only the uterine fibroids in a procedure called myomectomy, Lefort, Schrodker, or Wertheim. So to answer this one, it's important to know that uterine fibroids are usually found in the muscle layer of the uterus itself. So you're going to want to remove part of the uterus muscle. So that's going to be an ectomy, and myo means muscle. So a myomectomy is going to be the removal of part of the muscle layer of the uterus. So what are these other procedures? So we have answer B, which is the Lefort operation. You go, oh gosh, that involves the facial bones. That's certainly not involved here, so I definitely can cross that one out. But wait, it gets a little tricky here. There actually is a Lefort procedure related to gynecologic surgery, and in this case, what we're doing is we're preventing uterine prolapse, where the uterus sinks down lower than it should be, and we're going to do that by suturing the vagina itself together to prevent the uterus from prolapsing through the vagina. Now, this would be in women who no longer wish to have sexual intercourse, but that suturing together of the vagina in order to hold the uterus in place is technically called a Lefort operation. So not to confuse the one that involves facial bones. The Schrodker procedure, that involves doing a cerclage or encircling the cervix of the uterus to hold it closed during pregnancy. And a Wertheim procedure is also a gynecologic procedure. This is a radical hysterectomy where not only the uterus, but also the fallopian tubes, the ovaries, and some of the surrounding tissue is also removed. Now notice what I did here. I didn't just find the answer to this question. I went through and I read and I made sure that I understood all the other answers that were included in this question. So I understood what a Lefort, a Schrodker, and a Wertheim procedure were. Why? Because, well, the odds that a myomectomy is going to show up both on a practice question and on a real test, may be a little bit low. But the odds that a Schrodker or a Wertheim or even a Lefort procedure could show up on the real test, yeah, that's much higher. So a much better chance of that happening. So make sure as you're studying these questions, go through all the answers and try to understand what each of them mean. Now, if you don't know what a lot of those answers mean, going through the internet and researching all of them is going to take a little bit of time. So here's another tip. When you're studying, get a study buddy. Find a friend who can study with you. Or better yet, find a study group that can study with you, because then as you go through these questions, everybody in the group can contribute to figuring out what is a Lefort, what is a Schrodker. So you might not know, but one of your friends might know, and that way you can get those answers more quickly and go through more and more questions and receive more and more information. So finding a study group is really going to be helpful going through these questions and helping you to remember a lot of this information. So let's take a look at another question. Hey, it's no longer Dr. Becca, now we have Peter Parker. But notice we have a whole lot going on here that we're going to have to figure out exactly what's being asked in this question. Peter Parker is scheduled for an emergency surgery to treat a perforated gastric ulcer. Parker has been on warfarin, Coumadin. The surgeon orders a CBC, complete blood count, and Parker's blood work is as follows. Hematocrit, 35%. Hemoglobin, 9 grams, white blood cell count, 6,000. Hematocrit is the percentage of red blood cells in the body. Parker's hematocrit is above normal range, within normal range, below normal range, or inconclusive. So this is a tough one. Now we have to remember not only how hematocrit is measured, but what's a good range. Is it too high? Is it too low? So let's review that. So hematocrit is measured by taking the patient's blood, putting it in a test tube, and then spinning it in a centrifuge. Now what that'll do is that separates the different parts of the blood. So red blood cells are the heaviest. They're going to be pushed down to the bottom of the test tube. White blood cells, the next heaviest, they're going to be the layer on top of that. That's this white layer, this thin white layer in the middle. That's called the buffy coat. Those are white blood cells in there. And then the lighter particles, some water, maybe some electrolytes, small proteins, things like that. That's going to make up the plasma, which will remain in the top part of the test tube. So the hematocrit is the percentage of red in this test tube, of the whole contents of the test tube. How much is red? How much is the red blood cells? And it helps to remember that this number should be between 1/3 and 1/2 of the total test tube. So probably a little closer to half, but between 1/3 and 1/2 is the general range. And the range does differ between men and women. So for women here, it shows 37 to 47% is a good hematocrit number. And for men, 42 to 52%, a little bit higher than for women, is a good hematocrit number. But basically between 1/3 and 1/2 of the whole blood should be red blood cells. So given that, between 1/3 and 1/2, closer to 1/2, 35% seems, well, it's just slightly above 1/3, but it's not very much above 1/3. So I would guess, and the correct answer is below normal range. So it is just a little bit below normal, especially for a male patient. So two things that you should notice from a question like this. First is that numbers are important. Some of those numbers, those sort of obscure numbers that you learned a while ago, they're going to come back. They're going to appear every once in a while, not in a lot of questions, but in a few of these questions, you're going to see during the national boards, you're going to see numbers that, boy, I barely remember that. So going back and studying a lot of these numbers, these number ranges, is really going to help you out in some of these tougher questions. And the other thing is there's a little bit of critical thinking involved. Not only do you have to know the number and know that range between 1/3 and 1/2 is a good range, but then you have to figure out, okay, his hematocrit is 35%. So where does that fall? So now we have to do a little bit of calculation, maybe a little bit of math there to figure out that, yes, this is indeed just a little bit below where it should be. So let's take a look at another question. Peter Parker is scheduled for, okay, Peter Parker again, that same setup that we saw before. And here's Peter Parker's blood work, all the numbers there. So what's the question? The question, due to Parker's white blood cell count, the surgeon may cancel the surgery since it's too low, give 2 units of blood to see if the white blood cell count will increase, perform surgery immediately since the white blood cell count is within normal range and will have no effect on the surgery, or give antibiotics since this indicates that an infection is present. Well, oh boy, here we go. We have to remember the numbers again. And in this case, they're asking, what is a good white blood cell count? And if you don't know the answer to that, well, it's probably a good idea to review that. So let's go ahead and do that now. Here's a few white blood cell counts based on age. You can see here that for a newborn infant, the normal range is 13,000 to 38,000, which is actually very high. Now, why is that? Well, because the infant's going from a nice, cozy little safe area, all of a sudden it's being thrown out into the big, scary, dirty world, and it's going to need a whole lot of white blood cells to help protect it from any diseases that it might encounter. So babies are usually born with a whole lot of white blood cells. But even after just a couple of weeks, after 2 weeks, those numbers drop by almost half. So 5,000 to 20,000 would be a normal range for a 2-week-old infant. Now for adults, the numbers are even lower than that. Between 4,500 and 11,000 is a normal range. Pregnant females in their 3rd trimester tend to have a slightly elevated white blood cell count, and that's because, again, we want to boost the newborn's white blood cell count to a nice high level before they enter the world. So given this, we're assuming that Peter Parker is an adult, so the normal range should be 4,500 to 11,000. Let's go back to our question. Parker's white blood cell count is 6,000. That sounds about right. That sounds normal. So the answer would be C, perform the surgery immediately since his white blood cell count is within normal range. So while we're here, let's explore a couple of options that might happen should that number not be in the normal range. Well, if the white blood cell count was a little too low, well below 6,000, let's say it was only 3,000, what could we do to increase that? Well, we could cancel the surgery. It's too low. Okay, sure. Let's look at B. If we gave 2 units of whole blood, would that increase the white blood cell count? Well, maybe a little bit, but probably not a whole lot, because whole blood is whole blood. It not only contains white blood cells, it contains red blood cells, it contains plasma and all of that. So at basically the same percentages that what particular artery has. So you're not adding necessarily a whole lot of white blood cells to the body. So the overall count for his whole body is probably not going to increase very much at all. So giving whole blood is not going to really change the white blood cell count. Now, if his white blood cell counts were very high, let's say well over 11,000, that's probably a pretty good indication that there is an infection present, and a good way of fixing that would be to give antibiotics. All right, so let's take a look at another question. Peter Parker, again, is scheduled for that same emergency surgery for his perforated gastric ulcer. But wow, there's a lot going on here. This is definitely not a little Kahoot question where it's real quick and easy to read. You've got to spend some time on questions like these. And it's okay to spend some time. You want to spend time on questions like these, figuring out exactly what's being asked, go through every answer to make sure you understand every answer. And if you have to spend 2, 3, 4 minutes on a question like this, do it. You have the time. Not all questions are going to be this long. Some of them are going to be short, and you'll be able to zip right through them. But some questions, especially when you encounter one like this, lots of words going on, lots of different details. You want to pick out the key details and spend the time to do that. Take your time. There's no rush when it comes to the national board. And this question is kind of fun, kind of complex, because the question itself is asking which lab test may the surgeon order, but the details of the answers really gets to the point of the question, which is, what is Coumadin? That's what this question's really asking. So we have to read through the answers to figure out what is Coumadin, and that's going to then lead us to which lab test we should use, and that's going to then give us the answer to this question. So it's a couple of steps involved in a nice complex question like this. So A, differential white blood cell count, since Coumadin is an antibiotic. Well, that's not right. Coumadin is not an antibiotic, so we can cross that one off. B, culture and sensitivity test, since Coumadin is an anti-inflammatory agent. So again, you have to know that Coumadin is not an anti-inflammatory agent, so that would not be correct. Prothrombin time, since Coumadin is an anticoagulant, which interferes with the synthesis of prothrombin in the liver. Wow, there's a lot going on there, but what the writers of this question are hoping you remember is that Coumadin is an anticoagulant. It stops coagulation of blood. Now, knowing that the method of action is that it interferes with the synthesis of prothrombin in the liver is not necessarily key to this question. The key to this question is knowing that Coumadin is indeed an anticoagulant medicine, so prothrombin time, that's probably going to be the best test. Let's read answer D just to make sure. We always want to read all the answers just to make sure we've chosen the correct one. Blood chemistry, since Coumadin affects the absorption of glucose from the intestines. And Coumadin doesn't really affect the absorption of glucose, so that's probably not a good answer either. So the best answer seems to be C, because Coumadin is an anticoagulant. It stops the coagulation of blood. So yeah, there was a lot going on with this question, and these challenging, kind of difficult questions that you sort of have to suss out exactly what the question's asking are going to be fairly common on the national boards. Now the next question, Peter Parker, again, scheduled for emergency surgery for that perforated gastric ulcer. This procedure will be placed in which of the following wound classifications? Oh, here's some numbers again, slightly different than before, but we have class 1, 2, 3, and 4. We have our clean contaminated, or dirty, or infected classifications. So which one best fits this particular procedure? Now, if we're not exactly sure, let's go ahead and review our wound classifications to see if we can figure this one out. So take a look at this chart here. It says that clean wounds are uninfected operative wounds without inflammation. Respiratory, alimentary, which is a fancy word for the digestive tract. Okay, alimentary, digestive tract, think of that. Genital or uninfected urinary tracts are not entered. So if any of those are entered, it's not considered a clean wound. So let's see if we can simplify this chart a little bit. There's a lot going on. Let's see if we can maybe narrow it down and try to make it just a little bit easier to remember. When I think of a clean wound, usually that involves an incision through the skin. So skin incisions are usually considered clean wounds. Not always, but usually. So that's a good sort of generalization of clean wounds. Clean contaminated, operative wounds in the respiratory, alimentary, which is the digestive tract, genital, or uninfected urinary tracts are entered, usually without contamination. So what we're talking about here generally are going to be mucous membranes. Again, not always. Clean contaminated wounds can involve others as well, but a good broad definition of clean contaminated, think mucous membranes. Now, contaminated would be open, fresh is key, accidental wounds, maybe operations involving major breaks in sterile technique, or major spillage from the gastrointestinal tract. The surgeon accidentally nicks the bowel and there's spillage into the abdominal cavity. Or incisions where there is inflammation present. So let's see if we can break this one down a little bit. So mostly what we're talking about here is major contaminations, inflammation, or spillage. So inflammation or clear contaminations of the surgical site, those are going to be considered contaminated wounds. So what's the difference between that and a dirty wound? Well, the difference here, for the most part, is time. In this case, we're talking about old traumatic wounds or existing clinical infections. So these are problems that have been around at least for a little while. They didn't happen necessarily during the surgical procedure. They happened before that. So another way of thinking about dirty procedures is, has it been a wound for greater than 4 hours, especially if it started before the procedure began. So think of a simple fracture of the arm. That's going to be the bone is broken, but it stays within the skin. That's not too bad. But if the bone protrudes from the skin and becomes a compound fracture, and that wound has been open for more than 4 hours, that would be considered a dirty case because bacteria could have gotten into that wound and spent time spreading before we were able to go in there and clean it up. So given those generalizations, let's see if we can figure out the answer to this question. This procedure would be placed in which of the following wound classifications? Well, what procedure? Let's go back and look. We're talking about a perforated gastric ulcer. Well, what is that? Well, gastric ulcer is a wound in the lining of the stomach, and if it's perforated, that means it has worked its way through all the layers of the stomach, and the stomach contents have now spilled, at least to some extent, into the abdominal cavity. Now, if this is an emergency surgery, that means that perforation probably happened before the patient even entered the OR, possibly even before the patient entered the hospital, which means most likely more than 4 hours ago. So the answer here, dirty or infected, it would be a class 4 wound. Let's look at another question, again using the same Peter Parker setup for that same surgery. The question, if the surgeon removes a portion of the pylorus of the stomach and performs a gastroduodenostomy, this procedure is called a pyloromyotomy, Billroth 1, Billroth 2, or Rowan-Y. So in this case, it's important to know exactly what's going on, a gastroduodenostomy. So there's the term ostomy, which means we're creating an opening. And if there's two terms in front of the term ostomy, in this case there are gastro and duodeno, that means we're creating an opening between these two areas. So between the gastro, which is the stomach, and the duodenum. And if you happen to remember that a gastroduodenostomy is a Billroth 1, good for you. If not, let's go ahead and review these real quick. Again, and let's say we had to take out part of the stomach, in this case, the lower part of the stomach around the pylorus. If we're going to connect the rest of the stomach to the duodenum, that's going to be a Billroth 1. That's a fairly straightforward procedure. If we have to take out a little bit more of the stomach and connect the remaining stomach to the jejunum, which is the second part of the small intestine, just a little bit past the duodenum, that's going to be a Billroth 2. And then a Rowan-Y is when we take out most of the stomach and run the jejunum all the way up almost to the esophagus, connecting it there, but leaving this little tail, leaving the duodenum in place because it's going to carry enzymes from the pancreas and bile from the liver down to the food that's being digested. So a Rowan-Y, where the intestine sort of looks like a Y shape at this point, that's going to be the most extreme of these procedures. Let's try another question where you have to read all the answers to really make sure you understand what's being asked. Oh good, it's not Peter Parker anymore, so we've moved past that. Okay, all of the following principles of aseptic technique are true except, oh, there's that word except. So now we really have to read all 4 answers to find which one does not belong. Sterile persons should pass each other front to front or back to back. Well, that's true. So again, that instinct to say, oh, well, that's true, that's going to be the answer. No, because this is one of those questions that has except. So we're looking for the one that is false. So A is true. B, self-gowning and gloving is performed on a separate sterile field. Well, that's true. You don't want to perform self-gowning and gloving on the back table because of the risk of contamination. So B is also true. C, when solutions are dispensed, the entire contents of the bottle are poured and the remainder is discarded. Yes, you absolutely want to discard the rest of the bottle. You don't want to use it again because of, again, the risk of contamination. So C is also true. And now let's read D just to make sure it really is false. If a sterile glove is contaminated during the case, the circulator will remove the contaminated glove and a new one will be donned using the closed gloving method. Well, wait a minute, that sounds right, because if I've contaminated my glove, I want the circulator to remove it and replace it. So wait, is that right? Well, let's look real close. There's one word in this answer that happens to be key, and that word is the word closed. So in this case, that one word, closed method, is what makes this answer false. Because when you put on that new glove, you're actually going to be using the open gloving method. So the answer is D, only because of that one word, closed versus open. A little tricky there. Now let's review what is open and closed. Let's make sure we understand that. So the way I think of open and closed gloving methods is look at the cuff of the sleeve. If the cuff of the sleeve, the white part of the sleeve, is closed, meaning your hand isn't sticking through it, that's going to be the closed gloving method. That's usually what you use when you first put your gown and your gloves on. But if the cuff of the sleeve is already open, and if you remove a contaminated glove, you don't want to pull your hand back through that cuff because that cuff is now going to be contaminated because it was touching your hand. So you're going to very carefully use the open gloving method to put a new glove on that hand. And notice here you can do open or closed for yourself, or somebody can assist you using both the open or the closed methods. So that was a pretty good question. You had a whole lot going on, and it was just one word, one key word that really gave you the answer to that question. So let's take a look at another question where we're really focusing on a very fine detail in the answer. All of the following statements concerning urinary catheterization are true except which one? There's that word except again. So we have to read all the answers, find out the one answer that is not quite entirely correct. A, sterile technique is required. Well, okay, we're doing urinary catheterization. The urinary area, that's going to be a dirty area. So do we have to use sterile technique? Well, yes, we do, because we don't want to add any additional infections to that area, any additional contamination. So even in a dirty area, we're still going to do our best to use sterile technique. So A is true. B, a Robinson catheter, this is going to be the Red Robin. This is going to be a straight catheter that's used to collect sterile specimen or empty the bladder. That actually turns out to be true. Those are a couple of reasons why you would use a Red Robin or a Robinson catheter. A 3-way Foley with a 30 cc balloon may be used following a TURP to allow for continuous bladder irrigation and to provide hemostasis by applying pressure to the prostatic fossa. All right, so on this one's a little tricky. Let's figure out what is a 3-way Foley catheter. So a standard Foley catheter has 2 inlets in it. One allows you to inject some water to inflate the balloon, and that's what's going to hold the catheter in place. The other tube is where the urine is going to drain out of. So one tube to inflate the balloon, the other tube to allow the urine to drain out of. That's a standard 2-way Foley catheter. Now, a 3-way Foley catheter has a third tube. So you've got the tube to inflate the balloon, you've got the tube to drain the urine and the contents of the bladder, but the third one is allowing the surgeon to inject irrigation to flush out the bladder. So you're going to put irrigation in one tube, it's going to come out the second tube, and again, that third tube is for inflating the balloon. Now, a 30 cc balloon happens to be a really big balloon. Most Foley catheters only have, say, a 5 cc balloon on them. That's enough to hold it in place. But with a 30 cc balloon, what we're doing here is we're applying hemostasis. Just like if you have a cut on your arm or something, you're going to put pressure on it. And putting pressure on the wound is going to stop the bleeding. Well, that's exactly what we're doing here. We're applying hemostasis. We're putting pressure on the wound, on the prostate that we've just scraped out of. And we're going to do that by inflating this giant 30 cc balloon, which is going to put a whole lot of pressure on the outside walls of that prostate and hopefully stop the bleeding. That's the goal of this 30 cc catheter. So answer C is also correct. Everything there is correct. So let's look at answer D. Let's read it just to make sure. If a 5 cc balloon Foley catheter is used, you should insert 5 cc's of sterile water into the inflation port. Well, wait, that sounds right. If you have a 5 cc balloon, you need 5 cc's of water to inflate it, right? So what's the catch here? Well, there is one little catch in this particular answer. And you might think, okay, maybe it's the word sterile. Maybe I should use saline instead. No, that's not quite it. You never want to use saline in a Foley catheter because the saline, the salt, can sort of break down that catheter. So you don't want to do that. So sterile water is correct. That's what you would use. The key here is the 5 cc's of water that you're going to use. And that's because it's going to take 5 cc's to fill the balloon, but it's going to take an additional 3 or so cc's of water just to get from the inflation port all the way up to the balloon. So you're going to need 8 cc's or so of water in order to inflate that 5 cc balloon, because 3 or so is going to remain in the tube of the catheter itself. So here, one little word, or in this case, one little number, happens to be key to finding which of these answers is false, and therefore the answer that they're looking for. All right, so let's look at one last question with a lot of information going on here. So let's see if we can figure out just what's going on with this question. Pediatric patients are not small adults. They have special needs, which include all of the following except A, a decreased circulation, which can delay wound healing. Well, I'm not sure. I mean, I personally was not sure when I read this question. So here's how I would approach a question like this. Right now, I'm thinking pediatric patients. Do pediatric patients have delayed wound healing? That I'm not sure about. So let's take the pediatric patients out and focus simply on delayed wound healing. Now, let me think. Who do I know who has delayed wound healing? Well, let me think about it. I think of older patients, maybe patients in nursing homes or things like that, where they have this decreased circulation, so their wounds take a long time to heal. Well, older patients are certainly the opposite of pediatric patients. So in this case, I'm thinking older patients are going to have that delayed wound healing. Pediatric patients probably wouldn't. So I'm thinking letter A is going to be false. So let's take a look at letter B. An increased danger in fluid and blood loss, which must be closely monitored or replaced. I'm not sure about that one either. Who do I know has to monitor a lot of their fluid and blood loss? I'm still not sure, so I'm going to put a question mark next to that one. All right, C. The possibility of a rapid change in body temperature due to their large skin surface area for a small volume. So heat loss is prevented by such methods as warm blankets, increased room temperature, radiant warmers, and bear huggers. All right, so this one I'm still not positive of. I think I have an idea. So let's take the pediatric out of it and think, who is it that loses heat rapidly? Well, I'm still not sure, but one thing that I know is that I'm a very large person. And I do not lose heat rapidly at all. In fact, I store a lot of heat. It takes me a long time to cool down. So I'm thinking a very large person does not lose heat rapidly, but a small person probably would, at least compared to a large person. So I'm thinking this one seems right. This one's probably true. All right, let's look at letter D. An increased need for oxygen in food due to increased metabolism. So they may be NPO prior to surgery for a shorter duration than an adult. All right, so let's take the pediatric out of this and think, who needs a lot of food because they have an increased metabolism? Well, again, I think of myself, and I know that as I've gotten older, I need to eat less and less because my metabolism is getting slower and slower. So if I'm getting older and my metabolism is slowing down, then I'm thinking younger people probably have a very high metabolism. So when I'm talking about pediatric patients, yeah, kids eat all the time and they never gain weight. How unfair is that? So that's probably going to be true. So let's look at the rest of this, make sure we understand it. NPO, that means nothing by mouth. They haven't eaten anything, and they need to be NPO, nothing by mouth, for a shorter duration than adults. Well, if they're increased metabolism, if they're burning through that food faster, yeah, it's probably not going to stay in their stomach as long, so they would need to be a shorter duration than adults would, where the food's going to last in their stomach for a lot longer. So that one also seems true. So what do we have? We have A, that seems kind of false, B, I'm not sure about, C, that seems true, and D, that seems true. So, because this is one of those except questions, we're looking for the one that is false. And I'm not sure about B, so I'm thinking A is going to be the best answer. That's going to be my guess. And indeed, that turns out to be the correct answer. So see how we went through those? We sort of took away some of the distractions in the question and thought about, okay, who would this apply to? Who would this apply to? And from there, we can figure out which one seems to be the most true, which one seems to be the most false. So in summary, here are my tips for studying for the National Board. When studying, review lots of questions, as many different questions as you can. That's going to help you out. Understand all the answers to that question, because while the answer to a practice question may not necessarily appear on the National Board, there's a better likelihood that one of the other answers could appear on the National Board, and that exposes you to more information, and that's a good thing. And number 3, study with a friend or maybe a study group, because the more people that get together to do this, the faster you're going to be able to go through all those answers, understand what each of those answers means, and you're going to get through more questions more quickly. So when actually taking the National Board exam, here are some tips. Number 1, take your time. This is not a Kahoot. This is not a scrub ball where you're trying to answer as quickly as possible and move on. You've got some time on this test, so use that time. If you have come to a question that has a lot of wording, takes a little while to get through it, to figure out what's going on, take that time. Give yourself that time to really understand what's being asked and what each of those answers are. Read through all the answers, because you might come to a question where you think, okay, this is a pretty good answer, and you're just going to choose that. But if you read further, you might come to an even better answer. There's not necessarily going to be completely right and completely wrong answers. Some are going to be okay answers, but some are going to be better answers. And it's those better answers that the question writers are looking for. And as I've said many times, watch for the word except. Except forces you to read all the answers, find the 3 that are true, the 1 that is false, and it's that false one that they're looking for. So I hope you found this video helpful. You're almost to the end. You've made it this far, just one last step to go. I wish you the best of luck on your national boards.